Welcome to Wake Forest Men's Health. Today we're talking about male fertility. I direct the infertility program here at Wake Forest Department of Urology as it relates to men suffering from this condition. So I'm going to give a basic overview of some of the problems that a man can face when trying to conceive with his partner. And we'll kind of guide you as to when it's appropriate to seek evaluation. So let's start with the basics, shall we? Male genital anatomy. Typically, men are born with two testicles, and the testicles have two basic jobs: produce testosterone and produce sperm. Okay? And this is done under stimulation from the pituitary gland. So the brain tells the pituitary gland to perform a number of functions. Stimulates the thyroid, stimulates the adrenal gland, but it also stimulates the testicles. So we have two basic signals. One's called LH, or luteinizing hormone. It tells the testicles to produce testosterone. And then FSH, or follicle stimulating hormone, tells the testicles to produce or to allow for the maturation of sperm. And it's important that this testosterone is produced within the testicle for sperm maturation or development and promotion to take place. If you were to bring testosterone in from outside the body, it could go up to the point of the brain and pituitary gland, either by itself or after being converted to estrogen in the fat tissue, and say, hey, hit the off switch, we're good. And then what happens is these signals decrease. And when these signals decrease, so can testicular volume, so can your own production of testosterone, and so can production of sperm. So that's an important thing to consider, especially with the number of men that are being asked to consider testosterone therapy. Also, we may see conditions where a man's testicles were not all the way down when he was born, a situation referred to as undescended testicle. Typically, this is picked up in childhood, and if it is, bringing it down doesn't correct all the exposure issues that were related to that high elevated testicle early on. It simply allows for better exams, which are important because testicular cancer is the most common cancer in men between ages 15 and 35. Now, when you're looking at the environment around the testicle, if the testicles are brought down, one thing to consider is the size of the veins and the cord leading to and from the testicle. If those veins are enlarged, it can be considered a varicocele. And there are different grades depending on how it's detected. If it's detected on ultrasound, we call it a 0. If you can see it on visual exam without doing any kind of physical assessment, that's a grade 3. The grades in between have to do if you can feel the enlargement of the varicocele. 2 is if you can feel it with the man at rest. And 1, only if the man bears down, what we call a Valsalva maneuver. There is some data to suggest that if a man has a varicocele and has an abnormal semen analysis, that correcting the varicocele may result in improvement and potentially increase the chances of pregnancy. Now, we define infertility as regular unprotected intercourse for approximately 1 year with failure to achieve conception. If that situation takes place, it's reasonable for a man to get a semen analysis. Typically, this is collected by masturbation, and it goes into a sterile cup and is evaluated by one of our embryologists. We want to have it arrive to the lab in an hour or less, typically with about 2 to 3 days of abstinence from ejaculation prior. And so when it comes to the lab, be evaluated under the microscope. We look at the volume of the specimen. If it's too low, most commonly it's because of incomplete collection. But if it's consistently low on repeat analysis, it may suggest obstruction. We look at the number, the total number, and how much per volume, or what's called concentration, to make sure that's normal. We look at motility. This involves how well the sperm move when they're evaluated under the microscope. And we look at morphology, or shape, to see if they're strictly meeting the criteria for what we consider to be perfect, if you will. If we see any abnormalities, it gives us some guidance as to what types of clinical conditions, medications, prior trauma could be involved and what we may be able to do to optimize a couple's chance at conceiving a child. So, if you have these concerns, if you want to be evaluated further or learn more about this and female factors, feel free to call us, get into the office, and we'll go over this with you.